Next guest has a very personal reason for wanting you to understand the signs and symptoms of a stroke. About 7 years ago, she had a massive stroke and now hopes her story will help save your life. Vivian King is a stroke survivor. She used to work here at TMJ4, so you probably recognize her. And Oby Nwabuzor is with the American Heart Association. We're so excited to see both of you ladies.
Well,
Thank you
it's
for having
good
us.
to be
Good morning.
here.
Good morning to you both. And we're going to talk in just a little bit about the details about your Go Red Couch conversation, which is coming up, and people should put this on their calendar, Thursday, May 28th. But first, Viv, you suffered a stroke in 2013. You joined us once before on the yellow couch to talk about it. It's so surprising, I think, especially because of how young you are.
Right. And I think, how young I was, relatively young to have a stroke, and then also how active I was. And I didn't have high blood pressure. I don't have history of stroke in my family. My cause was birth control pills over the age of 40, according to my doctors. And there are several lists of risk factors for stroke, and we are in the middle of Stroke Awareness Month. And so I'm really hoping that people find hope through my book and also can start this dialogue about the risk factors. And birth control pills over the age of 40 is a risk factor. It can cause blood clots, and that's what caused the blood clot in my brain that led to my stroke.
Yeah, that almost killed you, Viv. I'm so glad that you shared that part of your story, the reason why doctors think it happened, because I think it's so important for us to understand those risk factors as well as the signs and symptoms. So can you address that also? What are the signs that people should and could be looking for?
So when you talk about a stroke, FAST is the acronym that you have to remember. So face drooping, that's what the F is for, face drooping. Arm weakness. If your arm is limp, you see somebody's arm not, working right, that's another sign. Speech difficulty. Now, people didn't really say I couldn't talk, but I was slowing my speech a little bit. I wasn't as effervescent as I normally am when they encountered me on this day that I had my stroke. And then the fortunate thing was the time, and they called 911 right away so that I could get immediate attention. And time is so important. If you notice the first FAS, then use the time to call 911 to make sure that somebody is getting the help that they need.
It truly makes a difference, and in your case too. And your book, When the Words Suddenly Stopped, is an important recollection of that day that you had this stroke and moving forward in the cause too. Oby, I want to talk to you now a little bit. One of the things that you say is that the African American community is more at risk for strokes. Why is that?
So, the reality is that many African-American communities have less access to fresh foods, safe places to exercise, and quality health care. So that means that they may have less healthy diets and be less physically active and may have higher stress levels. And all those things lead to early development of heart disease and stroke risk factors.
You're the community impact director. Are you doing things to reach out directly to the African American population so that people can have this information?
Yes, definitely. One of the things that we're doing is we have a program called Check, Change, Control Cholesterol, and we have a blood pressure program that we do in various community settings. We work with the Social Development Commission, we work with the Housing Authority, and we've even worked with Advocate Aurora Healthcare in that programming.
It's so positive that you're taking action like that to be preventative as it relates to strokes. And Viv, what do you want people to take away from your story?
I want people to, first of all, patients to have hope and their families to have hope that you can get through this. I want people to make sure that they are talking to their doctors about risk factors. And when I talked to women and told them that birth control pills over the age of 40 was the cause of my stroke, half the women said, yes, I kind of knew that. My doctor took me off birth control pills in my mid-30s. The other half, though, were wide-eyed and said, wait, I'm over 40 and I'm still taking birth control pills. We're all different, but you need to have the conversation with your doctor to make sure that that is on the table and that you're finding out everything that you need to know about that. So I really want people to advocate for themselves and talk to their doctors.
Such important stuff, ladies. You have this American Heart Association Couch Conversation. It's Go Red Couch Conversation featuring Viv. It's happening next week to create awareness, talk about the signs. This is an opportunity for anybody to register. What people need to do is email. There's an email address there to Corey at heart.org. People can also visit the American Heart Association Wisconsin on Facebook to register, and it's next week Thursday at 5:30 p.m. on Zoom. And it's absolutely free, correct?
Correct. It's absolutely free.
Wonderful opportunity to share the important information that you talked to us about today. Thank you both so much for joining us. And Viv, I'm so glad that you made it through, that you've lived to tell your very important story.
And thank you so much. And Molly, can I just say one more thing, that if people purchase the book at Boswell Bookstore between now and the end of May, a portion of the proceeds will go towards this campaign that really is following Jasmine Johnson, who will be the 2021 Go Red for Women chair. So this is a kickoff to her campaign. So I wish she could be here with us, but I wanted to mention that.
Sounds great. Thank you again both so much. I appreciate it. And we'll be right back after this break.